is a pre and post X-ray of a patient without the corrector and one with the corrector. So the X-ray taken is a lateral view of the neck or cervical spine. A way we can make our measurement is, this is oftentimes just a cutout of what a normal cervical curve should be like. This is just a cursory review or screening of someone that has lost the cervical curve versus one that has gained greater cervical curve with or without treatment. In this case, it's without and then with the corrector. So if we look and highlight the normal curve with a solid line, that's the way it should be. And then I'll put a dotted line to further delineate the way the patient is in their leisure posture. Okay? And you can see the difference. If we went to measure the difference, we would see that at the top of the cervical spine, we're almost at 1.25 inches of forward shift of the skull and spine, which is a poor or slouching posture. Okay. Now, when we come over to here and we look and do the same measurement, in fact, let's go ahead and do, this is the second, third, fourth, fifth, sixth, and seventh vertebra. This is the second, third, fourth, fifth, sixth, and seventh vertebra. And we'll go ahead and put the cutout at the same level as where the first one was, and we take our measurement again and draw a solid line. Okay? Now, the solid line is here. The dotted line is then placed along the way the spine is here. And the measurement was, remember, 1.25 inches. And now we are at a little less than 1 inch. So the patient gained about a little more than 1/4 inch in more erect posture at the cervical spine. So that's a significant difference. Exercising with the device, you would eventually have improved musculature, more conditioned muscles that surround the back of the spine, which is what's important for holding the posture. And by conditioning those muscles, it would allow for more of a alignment of the patient's current posture to what it ideally should be like. This particular patient, as time goes on, just like any other, we all tend to degenerate and shift forward, which we have that slouching posture with age. That's what we want to try to fight against. So you've got improvement based on an active or proactive response, not only reversing what you already have, but also taking into consideration how much worse it would be if you did nothing. So as time goes on, this difference in what we call forward translation of the spine would increase. We typically call it the hump, the slouch. So that's what we want to try to fight against as well.
Have you ever seen anything that affects somebody's posture so immediate?
No. It takes quite a bit of conditioning of the muscles to hold that posture into place. Somebody can go ahead and just bring their posture up, based on their own ambition, but it's hard to hold it there. Whereas, a device like the corrector would allow you to be conscientious of it through the day, and it's elastic, so your position can be more dynamic. The fact that this patient needs a significant amount of exercise, only over a couple of months period, would they then start to be able to hold that posture on their own. Utilizing a corrector, you can assume that posture for an extended period of time because you have assistance but not weakening the muscles because it's dynamic. The focal point of her curve where it turns is right at C5 and 6. That's where most people get spurs that form, right along here, because that's where all the weight of the head starts to, when it's shifted like that, and you've lost that cervical curve, all that pressure is taken up at the 5th and 6th bone. That's where you get these spurs that form because the body says, hey, I can't handle this pressure, and so it starts laying down bone tissue, almost like calluses on the hand. This is a spur. So she'll absolutely have potential for spur formation at that area because of such a difference here. Now, look at this. See the difference here? Now, look at C5. Almost lays butt up against that ideal curvature.
Yeah.
So now the pressure's off, or is less than it was here. Do you see the difference? And so it's the tape. Even though it tapers out still, that's what still needs to be worked on. So corrector and exercise together would be a perfect marriage. So, and then look at C4, the difference. I mean, we can measure in millimeters all the way up from the top down to C6 or C5 and see differences all the way up. So the difference between what's ideal and C4 is a lot less than where it is here. Okay, so we're consumed by the biggest difference here and here, but there's a lot of benefit to the other bones in the spine because they all